Hey there and welcome back. In this video, we want to talk about sticking to the plan. What do we mean by that?
What we mean is we want to make sure that you follow through with the care that we lay out with you and not give up just because we get out of pain. In fact, that is one of the areas where most of us, including ourselves, is it's not hard to get out of pain. Honestly, we can generally get people out of pain
Very quickly.
Yeah, very quickly. But the problem being is we don't actually heal as fast as we feel good.
Yeah.
So we want to make sure that we not just get you out of pain, but we want to make sure we get you to your actual goals. And that is to, get out of pain and then not fall apart next week.
Yeah. We want our patients to know something without sounding arrogant. Dr. Allen and myself are really good at what we do. We've got literally combined well over 20 plus years of combined clinical hands-on experience. We've literally helped thousands of patients over the years. And so we want patients to understand something really important, that when it comes to your care, you really have two choices. You can either follow the prescribed plan that is based off of years of experience, or you can kind of make up your own plan, and really with that, results are going to vary greatly.
You bet.
And so while we let our patients choose for themselves what they want to do, we help them understand. One of the things that we share with patients is kind of a little map that we created, really helping them understand the difference between feeling versus function. Patients will oftentimes pose the question one way or another to us of, can't I just stop care once I feel better? Because a lot of times it's confusing and again, reasonably, understandably
Makes sense.
so. Why would I keep coming back when I feel better, when I think the problem is gone? But the point that Dr. Allen already pointed out is that really the problem, right? And so what we see here on this is the question that we pose back to our patients when they ask that is it really depends. Do you want temporary relief or do you want a permanent solution, right? And so what happens with most people is that they have some sort of an initial problem. I would say this is probably 80 to 90% of the patients that we have. Barring the rare occasion when you have somebody who's in a car accident or a slip and a fall injury or some other acute injury, more often than not what we find is most people come in and see us who have been dealing with problems, whether they realize it or not, for a year, 2 years, sometimes as much as 5 years or a decade or more. And what starts to happen is there's little to no symptoms at the beginning until eventually what happens is we get to a point where you see there at the bottom, you have major symptoms to the point where all of a sudden
You're forced to take action.
Yeah, you can't function. And so then what happens here is this kind of what we call the temporary pain relief roller coaster. What's that all about?
Well, we treat you a few times and you're like, oh wow, my pain's a lot better. I can get up and function again. And so what happens is we, and again, this is just our human mind. We're like, I don't hurt anymore and I can move. So we go about moving and we're like, well, I don't need to go back and finish my care. So what happens is you get out of pain and then you go back to the same things that initially caused, the reason we have pain and the reason we have symptoms is because of functional deficits or functional limitations, right?
Yeah.
So we start repairing some of that function and the pain goes away, but we don't completely repair it. So what happens is we have these relapses.
Yeah.
And, I've had patients just this week that said, oh, I've been dealing with the same thing for 15 years or longer, some of them. And it's because, we do just enough to get out of pain. And then over the course of maybe weeks to months, we're right back to where we were.
Yeah.
And so just remember, when you put on a shirt or a shoe or bend over to pick up your kid or put something in your car and your back goes totally sideways and hurt, your crazy spasm and shut down, that's not normal.
Yeah.
That should never, ever happen in a healthy spine.
Yeah. And we hope that if this video applies to you, that you take this to heart, but also if you know somebody, which I think most of us do, where this applies, share this video with them, because we hope that this makes perfect sense. Because really at the end of the day, that symptom relief line or the I feel better line is merely just that. That's just the symptom relief line. We get you to that point, and as exciting as that is and as fantastic as that is, there is a better option yet still that we often encourage our patients to seek after, and typically our care plans reflect this, is helping people get to an improved level of health and function. And the beautiful part about what we teach at our clinic, in fact, our slogan is short-term care, long-term results. And the whole idea is this: you don't have to be on a care plan in our clinic for an entire year, 3 times a week. We know that sometimes can be the cliche example that people think of when they think of chiropractors, but at our clinic, because we have the combined integrated approach, we're able to get results much faster, much longer lasting. But it does require you still sticking to the care plan that we prescribe for you. So, the analogy that we would use that's a very good comparison is something like antibiotics. They tell you to take the entire course of antibiotics because even though you start to feel better within a couple days, you need to finish that course off because that's what really ensures that
you've killed all of the bug.
Killed all the bug, right? Or a broken arm or a broken leg, right? Once you get that cast on, things feel better within a day or two, typically.
Very quickly.
But that doesn't mean that the fracture has completely healed. No different with functional problems that we're dealing with, whether it be back pain, neck pain, shoulder pain, or some other type of musculoskeletal problem or other problems. Healing does take time. So we didn't invent that. That's just normal, basic human physiology. And so that's the way it works. And so what we're here to do, though, is to help people fix these problems and not just go through this roller coaster. And the problem is, as you see here, is as time goes on further and further, it takes longer to heal the problem or to get the relief that you once got. And eventually what starts to happen is the window of conservative options starts to narrow, and you start getting further and further towards and closer towards more nasty, ugly things like surgery and things like that. And so we want patients to avoid those things. We're here to help with that. We want you to function. We want you to feel great, but we want to fix the problems, not just get you temporary relief. So hopefully that makes perfect sense. Anything you want to add there?
No, but just the true fact that we really do, it's all of us do it. It's really easy to we feel good, so we forget about what's important. It's like going to the gym, and you can't go to the gym and all of a sudden start feeling good and be like, okay, I'm done.
Yeah.
You know what I mean? It's like, it takes constant energy and effort. It's not hard. It just takes consistency.
Yep.
So we hope you'll stay consistent. We hope you'll let us get healthy, truly healthy. And then from there, kind of help you just manage and maintain your healthy body.
Yep. We're here to help serve you as best we can, however we can. So we hope that you're excited. And again, we love helping our patients. And thanks for watching this. Share this with anybody that you feel could benefit. And we'll talk to you guys soon.